Good day everyone. Today I will show you the different projections of my patient lower extremities. I have here the different sizes of the radiographic image receptor. First is the 8x10 size of the IR. Second is the 10x12 size of the IR. Third is the 11x14. Fourth is the 14x14, and the last but not the least is the 14x17 size of the radiographic image receptor that we are using inside the laboratory. The first projection that I will show you is the AP projection of my patient foot. So, bale po dito nakadepende po yung size ng IR na gagamitin natin sa size ng paa ng pasyente. So, the patient is seated at the radiographic table. Dapat yung knee ng patient is flexed. Naka-flex siya. So, the affected side is the right foot of my patient. Always remember na yung primary marker is always on the right side of the image receptor. Kasama yung secondary marker. So, sabi ko nga kanina, yung knee ng patient ng pasyente is naka-flex siya. And then, the foot of the patient is in contact with the IR. So, the central ray must be perpendicularly directed at the base of the metatarsal. Para ma-reduce po natin yung distortion ng ating or ng foot ng ating pasyente, dito po pumapasok yung sinasabi nating AP axial projection of the foot of our patient. The central ray is perpendicularly directed entering the metatarsal. Yung central ray po natin dito sa AP axial projection is na-angle siya 10 degrees posteriorly. This projection demonstrates the interphalangeal joint spaces and the metatarsophalangeal joint spaces. The next projection is the AP oblique medial rotation. The position of the patient is still the same as the AP or AP axial projection of the foot na ginawa natin kanina, wherein yung knee ng pasyente is still flex, yung foot is in contact with the IR, but put it in your mind that the patient's foot must be rotated 30 degrees medially or internally. So, dapat yung foot ng pasyente is nasa gitna talaga siya bago mo siya i-rotate 30 degrees internally. So, the central ray of this projection is perpendicularly directed entering the base of the patient's third metatarsal or metatarsal. This projection will demonstrates the interspaces between the cuboid and the calcaneus, the cuboid and the fourth and fifth metatarsal, the cuboid, and the lateral cuneiform, and talus and the navicular bone of the foot. The next projection of the foot is the AP oblique lateromedial projection, wherein the patient is still seated at the radiographic table, dummy radiographic table, comfortably. The knee is still flexed and the foot is still in contact with the IR. Wherein the central ray is perpendicularly directed entering the base of the patient's metatarsal. So, dapat pag pinag-uusapan natin AP oblique lateral projection, yung foot ng pasyente is ma-rotate siya 30 degrees externally or palabas. 30 degrees. Ayan. Tapos, ito yung central ray natin. Doon siya sa may papasok siya or enter siya sa may base of the third metatarsal of the patient. This projection will demonstrate as the interspaces between the first and the second metatarsal and the medial and intermediate cuneiform. Next is the lateral projection mediolateral of the foot, of my patient foot. Instruct the patient to lie on the radiographic table and turn toward the affected side. The lateral aspect of the foot is placed directly in contact with the IR. Ensure that the longitudinal axis of the foot of your patient is parallel to the longitudinal axis of the IR. The central ray is perpendicularly directed to the base of the patient's third metatarsal joint. Dito siya. Kung meron tayong lateral projection mediolateral, meron din tayong lateral projection lateromedial, wherein the patient lie on the radiographic table, pero dapat nakaturn siya toward the unaffected side. Unaffected side. So, dapat yung longitudinal axis of the patient's foot is parallel to the longitudinal axis of the IR pa rin. The central ray is perpendicularly directed entering the patient base of the third metatarsal. It is still the same as the lateral projection mediolateral. This projection demonstrates the entire foot in profile, the ankle joint, and the distal end of the tibia and fibula. Distal end of the tibia dito, tapos distal end of the fibula. The next projection is the APHL composite method. The patient is still standing at the radiographic table. The foot is at the center of the IR. The central ray is angled 15 degrees posteriorly, entering the base of the third metatarsal bone. So, ito yung first exposure natin sa APHL composite method projection. The central ray is angled 15 degrees posteriorly, entering the patient or entering the base of the patient third metatarsal bone. 15 degrees lang yung angulation nung central ray. The second exposure is the unaffected foot of the patient is placed anteriorly to the affected foot. So, make sure na hindi natin ginalaw yung first exposure natin kanina. Ito yung affected side. Make sure na hindi siya gumalaw or ginalaw kanina. The central ray is at the back. The central ray is at the back of the patient entering the posterior aspect of the patient ankle with the angulation of 25 degrees anteriorly. 25 degrees anteriorly. Dito siya mag-enter. This projection demonstrate the all bones of the foot, or this projection demonstrate all bones of the foot free of the leg. The next projection that I will show you is the different projection of the ankle. First is the AP projection. The patient must be in a supine or seated position with the affected limb fully extended. So, yung patient ko po is naka-supine position siya. Nakahiga siya in supine position. So, i-extend ko yung limb ng patient. So, the central ray is perpendicularly directed midway between both malleoli or perpendicularly directed to your ankle joint. Dito siya. So, this projection demonstrates the distal tibia and fibula, distal tibia and fibula, and the patient tarsal bones. The next projection is the AP oblique ankle mortis projection. So, place the patient in supine position or seated position. So, yung pasyente ko, still naka-supine position siya. From AP of the patient ankle mortis, rotate the leg and the foot internally. Rotate the leg and the foot internally 15 to 20 degrees. Until the malleolar plane is parallel with the IR. So the central ray is perpendicularly directed entering the ankle joint midway between the malleoli. This projection will show you or demonstrate the entire ankle mortis joint. The next projection that I will show you is the different projections of my patient leg. First is the AP projection. Ensure that the patient is seated at the radiographic table. Instruct the patient to extend the affected leg. The patient is seated and extend the patient leg. Ensure that both joints are included, the proximal and distal part. The central ray is perpendicularly directed, entering the patient mid portion of the leg, or the IR. Central ray. This is the central ray. This projection will demonstrate us the tibia, the fibula, and the adjacent joints. The next projection of the leg of my patient is the lateral projection, medial-lateral. First, instruct the patient to turn toward the affected side. Turn toward the affected side, and the knee of the patient must be slightly flexed. The central ray is perpendicularly directed to the midpoint of the patient leg. This projection will demonstrate us the tibia and fibula and adjacent joints, just like the previous projection of the leg that I showed earlier. The next projection is AP oblique medial rotation of the leg, of my patient leg. The patient is seated at the radiographic table. So ensure before the exposure, dapat yung pasyente is nakaupo siya sa radiographic table. From AP, rotate the leg approximately 45 degrees medially. Flex. 45 degrees medially. Not just the foot, but also the leg. -45 degrees. Medially. Or internally. Ensure that the leg is turned inward. Not just the foot. So, yun yung sinabi ko kanina. The central ray is perpendicularly directed to the midpoint of the IR. This projection will demonstrate us the maximum interosseous or interosseous space between the tibia and fibula. So, kung meron tayong AP oblique medial rotation, meron din po tayong AP oblique lateral rotation. The patient is seated at the radiographic table. From AP, rotate not just the leg, hindi lang po yung leg ang i-rotate natin, but including or kasama yung foot, na i-rotate natin externally, approximately 45 degrees, externally or palabas. 45 degrees. So, the central ray of this projection is perpendicularly directed, entering the mid-portion of the leg or the mid-portion of the IR. This projection demonstrates us or will demonstrate us the fibula is superimposed by lateral portion of the tibia. The next projection that I will show you is the different projection of the knee or of my patient knee. First is the AP Rosenberg. Place the patient in supine position. So, nakahiga po yung pasyente natin. Center the knee to your image receptor. So, sabi dito, kailangan yung knee is nakacenter siya sa may image receptor natin. Ensure that the long axis of your knee is parallel to the long axis of the IR. The knee is centered at the IR. The central ray of this projection is directed to a 0.1/2 inch inferior to the patellar apex. It is perpendicularly directed to a 0.1/2 inch inferior to the patellar apex, with the angulation of 3 to 5 degrees caudad. So, nakikita naman natin na payat yung pasyente or yung pasyente ko, kaya yung angulation niya is masasabi kong 3 to 5 degrees caudad. This projection will show us the open femoral tibial joint space, the proximal tibia and fibula, and the distal femur. Distal femur, proximal tibia and fibula. And the open femoral tibial joint space. Next is the lateral projection, mediolateral of my patient knee. So instruct the patient to lie towards the affected side. Towards the affected side. And then flex the knee of the patient 20 to 30 degrees, or flex the patient the knee of the patient 20 to 30 degrees. The central ray of this projection is directed 5 to 7 degrees cephalad, entering 1 inch distal to the patient medial condyle. This projection will demonstrate us the completely superimposed medial and lateral condyle, the proximal tibia and fibula, the distal femur, and the patella free from superimposition. The next projection that I will show you is the intercondylar fossa, or the different projection of my patient's intercondylar fossa. First is the PA Holmblad or PA axial Holmblad. Meron tayong unang way para ipakita yung projection na to. First, instruct the patient to be in standing position and must flex the knee approximately 70 degrees from full extension. The central ray of this projection is perpendicularly directed to the patient lower leg, entering the superior aspect of the popliteal fossa and exiting the level of the patellar apex. For the second way of PA axial Holmblad, we will be using a vertical cassette holder. So imagine na ito yung vertical cassette holder, tapos nandito yung cassette natin. We will or instruct the patient to bend her knee 70 degrees. The knee should be in contact with the IR. The third and original position of the patient described by Holmblad is the patient must kneel on the radiographic table. The central ray is perpendicularly directed to as the same sa PA axial Holmblad natin kanina. Ito siya papasok. This projection will demonstrate us the femoral condyles, eminences, and the intercondylar fossa. Next is the PAH Camp Coventry method. Instruct the patient to be in a prone position. So, yung patient ko naka-prone position na siya kaagad. From the prone position, place the intercondylar fossa at the center of the IR. So, naka-place na siya sa center ng IR natin or image receptor. And then, flex the patient knee approximately 40 to 50 degrees. So, naka-flex na rin siya 40 to 50 degrees. The central ray is perpendicularly directed to the patient lower leg. This projection will demonstrate us the intercondylar fossa free from superimposition and intercondylar eminences. So the next projection that I will show you is the different projection of patellofemoral joint. The tangential projection Segata's method. First, place the patient in prone position. So yung patient ko naka-prone position na siya. Then flex the patient knee, placing your patella in contact with the IR perpendicularly. Flex the patient knee. This projection central ray is perpendicularly directed to the IR. This demonstrate the vertical fractures of the patella. The next projection that I will show you is the different projection of the femur. First is the AP projection. Place the patient in a supine position. So, naka-supine position na kaagad yung pasyente ko. And then, center the affected thigh to the midline of the IR. This projection central ray is perpendicularly directed, entering the or my patient mid-femur or IR. This projection demonstrates us the AP projection of the femur, including the knee joint or hip. Knee joint or hip. Next is the lateral projection of my patient femur. Place the patient in lateral recumbent towards the affected side. Ensure that the limbs are abducted to avoid shadowing. And then flex the knee in order to place the patient condyles perpendicularly to the IR. Side ka. Abduct. This projection will show or the central ray is perpendicularly to the patient mid-femur or IR. It is perpendicularly directed to the patient mid-femur or IR. This projection will demonstrate us the superimposed condyles, entire shaft of femur and femoral head.